Good evening, everyone. Okay, good evening, everyone. Welcome to the Tuesday, January 21st, 2020 Board of Health meeting. I'd like to call the meeting to order. And let's get started with the Pledge of Allegiance. Okay, good evening, everybody. I hope you had a wonderful holiday season and Happy New Year's 2020. So welcome, everyone. I'd like to start with an introduction of Maura Mulrooney. So welcome, and we're really excited to have you representing us on the Board of Health, and you're representing the 5th Ward as a commissioner. And a little background. So you're a lawyer. You work for the Director of Development and Communications for the Support Center for Child Advocates in Philadelphia, legal aid and social services agency serving abused and neglected children. So what a wonderful career. So anything else to add?
No, I'm happy to be here. I'm going to learn as much as I can as quickly as I can. So thank you.
Well, we're thrilled. Thank you so much for serving on the board, and any questions or concerns, we'd be happy to answer them. So again, welcome. Exciting. Okay, so next on the agenda. So everybody have a chance to look at the November or the December meeting minutes? So any...
Can we correct the agenda to say the review?
Yes. Yes, I see that. Okay, thank you very much. Okay, so any a motion to approve the December meeting minutes?
Move to approve.
Okay, all approved? All right, perfect. Marie, would you like to give the health officers a report, please?
Sure. Good evening. Just to let you know, we did 12 food safety inspections this past month. We didn't do any pool inspections. We put them on a quarterly schedule last year, so they should start next month. And we had 4 public health complaints. It was pretty quiet around the office over the holidays, which is nice. Just to let you know a few events that took place. Radnor Township School District, they have their Radnor Speaker Series, and they had former NFL quarterback Ryan Leaf come talk on the 14th to talk about his addiction and recovery and second chances and things. It was a really interesting talk. I did not go, but I read about it. It was a full house that night, and I heard he did really well. If you go to the Radnor Township School District website, there's a link there to the article in the Mainline Times. You can read about it. Secondary with the Radnor Township School District, they are trying to promote National Unplug Day. They want to start this in February and kind of promote it for the month leading up to the actual National Unplug Day, which is in March. I have to double check the date. I was told it was the 11th, but I think I read today it was the 6th into the 7th. So they've reached out to Radnor Township, our PIO, Molly Gallagher, and they want to kind of form like a partnership in helping to promote that. So once I get information on how they want to go about it, I will forward to you. I'm waiting to hear from the school district. A little bit about National Day of Unplugging, it's called. Basically, it's 24 hours global respite from technology to connect with others in real time. They're challenging you to take the pledge. You can go to the website and kind of sign up and do it that way. And then lastly, I just forward everybody a copy of the House Bill 97 just to kind of add on to the conversation that you all had last month, or the last few months. Thank you.
Thank you, Marie. That sounds very interesting, Unplug Day. So yes, I'd be interested in hearing a little more about that. That would be very interesting to see if we could do that. Okay, some old business. So we have on the agenda vaping in public spaces, the Clean Indoor Act, and a follow-up to that. So I didn't know if anybody had any background. Thank you, Charlie. Did you find the House Bill 97 was approved by Governor Wolf or signed into law? Okay, so basically it defined ends and smokeless tobacco. It talked a lot about children not using, from ages 6 to 21, not using any kind of electronic cigarettes on school buses and in schools, and really further defined what e-cigarettes were, pipes, hookahs, et cetera. So I don't know if we need to enact an ordinance, if this is law now, or what the suggestion from the board is.
I was a little surprised that it really only, it was good to have those definitions. Certainly, that was good to see that they defined it and how the definition of, tobacco and versus nicotine and where they, interact in terms of the vape products. But I was surprised that it really only made mention of sort of vaping as an issue as occurs on the campus, on school campuses. And that sort of bothered me because I think it's an issue for everybody. And I kind of feel like we should be doing something about not having it be sold. And I don't know if that's something that the township can do. We can go a step above, but not a step behind state law. But is that something we want to look into? I just think there should not be vape products being peddled in Radnor Township.
So you raised, I think there are two issues in what you raised. One is public utilization. And I thought we had agreed that we would make the suggestion to Board of Commissioners that we felt that regulation of vaping in public should reflect the same as regulation of smoking in public at least. And I don't think we had any controversy around it. The additional piece you're talking about is the commercial side, whether or not it should be legal to sell vaping products. And I think that if we separate them, we're likely to have an easy path in terms of local regulation around vaping in public. I think there will be some resistance to the notion of prohibiting commerce that is not otherwise prohibited at the county, state, or federal level in the township. I'm not saying it can't be done, but I think you'll get a whole lot more, correct me if I'm wrong, a whole lot more resistance to enact local regulation against selling products that are not illegal otherwise.
Wasn't it just recently, I want to say Philadelphia, where they're trying to pass a law that will not allow vaping products to be sold under the age of 21? So it's not that you're not allowing the sale of these products, but you're limiting the sale based on age.
Right, and I'm not necessarily, I'm not saying favor or oppose. I'm saying there are two different issues that we could raise, and one is public utilization of the products, and I don't think we got any resistance to the notion that public utilization of vaping products should be the same, restricted in the same way that public utilization of smoking products is. I think it seemed to me that that was a no resistance pathway. I think that if we wanted to take it on, we might be able to do what Philadelphia does or more, but I just think that would be a much more significant slog, just like it was really hard, and we didn't get it done to get any additional regulation on the sound or air pollution involved in the garden cleanup, the yard cleanups and leaf cleanups. It's going to be a very different game to get the preclusion of sale of products, whether you're restricted to sale to minors or talk about preclusion altogether of the sale of those products. It's a much different enterprise. If somebody wants to take it on, it might be achievable, but I think that if we just sent a recommendation to the Board of Commissioners around making sure that the local regulation is the same for vaping products as it is for smoking products, based on our conversation up to now, I don't anticipate a huge amount of resistance to that. but I would say that you will run into questions and areas of resistance in terms of the restriction of commercial endeavor.
Well, Linda, from your research with the vaping that you did last year, are there warnings on vape products? I can't remember, like there are on cigarettes?
So the stuff that's sold legally has to be FDA approved. So I'm not quite sure, I'm sure it probably does have something on it.
Just don't know what's in it.
Yeah.
Definitely.
Where it says it's Surgeon General, blah, 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 blah.
Yeah, I don't know what it has on it, but there are labels.
Yeah, I'd have to look at
I'll have to
packaging to
check
be
it out.
100% sure, but I know whatever's sold legally has to abide by the FDA regulations. It's the stuff that's bought on the black market, gosh knows what's in and not regulated.
My understanding of the House Bill 97 that was signed into law is that it does prohibit in the state of Pennsylvania sale of tobacco products, including vaping products, to people less than 21. Is that correct? Yeah. So and my understanding is that the township doesn't have a smoking in public places ordinance of its own, that it's encompassed underneath the Clean Air Act of, like Pennsylvania's Clear Air Act.
Correct.
And at this point, that only refers to cigarettes, I think. Correct. So if we wanted to pass an ordinance, we'd have to, obviously, we would also include cigarettes, even though it's encompassed within
I think
the Clean Air Act.
last meeting, what we discussed was that all you would have to do to preclude the utilization in public, as with cigarettes, would be to redefine
Got it.
the parameters of the Clean Air Act, not necessarily pass another entire regulation.
Got it.
But again, if the state law precludes the sale, then do we need to do anything additional? So the sale part is, if the sale part is part of the state regulation, then we really have no further obligation, and I don't know what we need to do that we haven't done yet, but I think we should heartily endorse that the township undertake to expand its understanding of the Clean Air Act to include not only smoking, but vaping products under the circumstances in which they're precluded.
Right. Agree.
Does our commissioner have any comments? No?
I don't have background in this, so I'm just listening now. Happy to take anything to the board.
So
Let's listen to each other.
I wonder if you could raise the issue with the board and ask them what they would like us to do to enable such, and if there's any resistance from the board, what they would need from us to overcome that resistance. That'd be
Is there any kind of signage in the township or anything that needs to be in restaurants or public spaces? I know I've seen smoking, but I don't know if the signage would need to be updated to reflect the language and,
They do have a generic smoking sign, but it's strictly, looks like cigarette.
is that for Radnor specific?
No, that's for the restaurants and public spaces for the Clean Indoor Air Act. I don't think everybody has it up.
Right.
It's there.
Is that something that's required for inspection when you go into a, I know like fire extinguishers and things like that would be required.
We look for it in Radnor Township, not all the time, it's not at the top of the priority list, and it can be something that, we can. I don't know, I don't remember, I read that Clean Indoor Air Act a lot last year, I don't remember it being in there about signage, but I don't know for sure.
And just to clarify, the Clean Indoor Act, that is a national or Pennsylvania state? Okay, so, and do you know when that was published by any chance?
2008.
Oh, yeah, that needs to be updated, so, right. Okay, so hopefully someone at the state level, that'll need to be amended.
Wasn't that the, Marie, what was it that you sent around? I thought that was the Clean Indoor Act as amended too.
That was House Bill 97. I mean, with the new language change in there, do you still need to send that
But that was just for the sale of vaping products as a tobacco product for people less than 21, right? I don't think they stated it in public places, and they talked about schools, but I don't think they talked about restaurants or grocery stores or. Okay.
Okay, so I don't know if it would be worth bringing up to the Board of Commissioners at this point.
I will bring it up to the Board of Commissioners, but I'm gonna need a little background. I'm gonna do my own homework before I do, but I'm glad to bring it up to the Board of Commissioners, that any prohibition for smoking should be the same, vaping should be included as the same as tobacco products. And I'll check to see what ordinance we might have in place that works alongside the state law. Frankly, I'm just not yet familiar, but I'm happy to bring it up to the board, and I don't see that there would be a whole lot of pushback on this, but I will keep you apprised.
And Marie, is there a place you could look at the different ordinances? I guess the township ordinances or what? Okay, perfect. Okay, perfect. All right, perfect. All right, thank you. That would be great. And then any help that we can, and I'm happy to provide the material I presented on vaping, if you're curious. Yeah. Okay, great. All right, thank you very much, everyone. Okay, moving on to old business, the Delaware County Health Study, which was the Johns Hopkins Bloomberg School of Public Health, was asking for input for county residents. I went to the meeting on January 13th at 10 a.m. Down in Folsom, Delaware County, and it was very interesting. So it was a group of representatives throughout Delaware County, various people from different organizations and residents. So basically, there was a lot of concerns around information sharing that would be very helpful for forming some form of Department of Health, looking at different clusters of illnesses and how to report that, incidents of asthma, and then providing information, maybe having some kind of repository of public health information that the county residents could tap into. Would be beneficial. So multiple different ideas were tossed out from food banks, disease, health management. The heroin task force was mentioned as a model for something that was very successful, not only in Delaware County, but nationwide, and how great that was. A lot about Upper Darby and Chester Borough having some issues as well around access to public health. So the outcome, what they're thinking of doing is they'll continue to data collect. There's still some, there was a meeting January 16th, and then they're going to have a couple town hall meetings that'll be open to the public at the end of the study, and then they're going to collect the data and report it out to the county leadership, and then they're going to work towards improving health outcomes in Delaware County residents. So more information to come on this, but it was really interesting to have a group of people from all over to discuss different issues that they've observed in the past years. So, Jane, I didn't know if you had any more from your health study. I know you went in December for healthcare providers.
No, I don't have anything else. Basically, what you saw and what was discussed is very similar to what we discussed back in December.
And I think the real big theme really was having a place where we could report public health issues and things like that, that would be one cohort of information sharing. So that was really the underlying message. And then how people, and when you think about disparities of care and populations, and how there might be some mistrust of people wanting to access different healthcare services, and how really to get into helping these people that are immigrants and that sort of thing access healthcare was another big issue. So it was very informative and worthwhile. So I'll be interested in hearing and seeing the summary of the report. So I'll make sure I get a copy of that and then share it with the board. The student intern projects. So I didn't know if Drs. Duman and Carabassi and the students wanted to talk about the student intern projects.
We can defer to the students.
So far, we've been just editing our survey questions and just refining them to make sure that we can get the best data possible. And we're planning to meet with Ms. Kegvis on Thursday to discuss about how we can get the survey out. And
we're also trying to decide like how we should display this information, like debating whether like we should do a website or like write articles. So we're trying to figure out exactly like the specific way we want to get the information out. That's really it.
So have you, do we know when Teen Health Week is this year? Yeah, usually I think it's March. I didn't see it. Yeah, okay. Usually they'll have that. So are you familiar with Teen Health Week?
I've heard of it, but like we'd be happy to do a presentation depending on when it is and based on like our findings. Because we
Right.
probably want to send the survey out in February because, midterms are next week. So we thought like, first of all, it'd be like hard for us to get it out that quickly. But also like, since it's about stress, like having huge exams when we're like collecting data would like significantly impact our results. So we're hoping to send that out sometime in February. So depending on like when we collect our data.
Very observant, and I think that's excellent because it probably would influence the amount of feedback you got on your survey, so that's great. Can you just describe your survey in a few words, what you're looking at?
So what we're trying to do is most of our survey questions revolve around how students manage their stress and like what are their biggest stressors. And we're going to try to collect this data and, as Leo said, probably put it into like maybe graphs on a website to show like what are the main stressors of students at Radnor.
And specifically, like afterwards, like a lot of people have stress and they identify that they have stress, but they don't really do anything to change it or like to like reduce it. So we want to research like other successful tips and possibly talk to like mental health professionals to help Radnor students relieve their stress.
That sounds great, and I know that, go ahead.
It looks like Teen Health Week is in April this year, as it was last year. Quick Google search.
Thank you very much. Yeah, and Teen Health Week is really good. So the interns last year would put out tweets each day on different topics. I'm not asking you to do that, but something maybe to explore if you find some good tips. And the Township has a Twitter account, so it might be something to think about. Yeah. All right, great. So awesome work. Thank you very much. All right, so I did for new business, I don't know if everybody has a copy of this, I downloaded some national awareness months, February through June 2020. So I didn't know if anybody would want to, on the board, would like to give a 5 or 10 minute presentation on any one of these topics. I'm not going to put you on the spot right here, but February is American Heart Month. March is National Colorectal Cancer Awareness Month, and April has a plethora of different topics to choose from, starting at Alcohol Awareness Month. May, arthritis, better hearing, and then June being Alzheimer's and some other ones. So if anyone, I'll put this out to the board members, so if you want to maybe present something, I'm happy to maybe give an update on vaping. So maybe some new statistics and what's going on with the laws. So I'd be happy to maybe do that one of the months. So if you feel the need, that would be great to give a presentation. That'd be awesome. Have a kind of short agenda. So anybody else have any new business? Okay, so in terms of announcements, I just wanted to say we're in the height of flu season. So it's nationwide, and we've had a lot around the flu and RSV. with pediatric patients, so we can still have time to get the flu shot. So if you've not gotten your flu shot, you can actually get your flu shot through March, early April, so it's not too late. And there's multiple places to get the flu shot in the township. And is there any public participation? I don't see any. So anybody else have anything else? This was a really short agenda.
Meeting adjourned.
Okay. Record time. Okay, so our next Board of Health meeting, just to note, everybody, it's on a Tuesday next month, so not a Monday. Tuesday, February 18th at 5:30 here in the Radnor room. So,
Monday's President's Day.
yes, it is. Thank you. And have a good evening, everybody, and that wraps up the Board of Health meeting. We're adjourned.